Hello, Caroline.
Yep.
Okay, great. Just checking back in. So we'll get started shortly after 12.
Okay.
Hello, this is Daniel from OPHA. I'd like to welcome you to our webinar today. We'll wait a few more minutes to allow others to join us, and then we'll get started shortly. Thank you. All right, so good afternoon, everyone. My name is Daniel, and on behalf of the OPHA, I would like to welcome you to our webinar. Today's webinar is titled Preconception Health. Let's Shift Our Focus. We will hear from OPHA's Reproductive Health Workgroup, who will share about OPHA's recently released position paper on preconception health. The workgroup will share highlights from the paper, which is titled, actually you can see it on your screen, it's titled Shift, Enhancing the Health of Ontarians, and explore future directions for preconception health here in Ontario. So before we dive in, just a friendly reminder that this session will be recorded and made available for viewing shortly after the webinar. We also encourage you to share your comments and ask questions into the chat box at the bottom of the GoToTraining panel, and we will address as many as possible following the main presentation. Lastly, if you do require technical assistance, you may send me a chat. I could be reached at OPHA host. And just a note, if you're using voice over IP or the computer and mic and speakers, and if you experience difficulties, please try switching over to telephone. We find that sometimes that's helpful. And also, we will be showing a video later on in the webinar, and it should work for those who are on the desktop version, but if you're on the web version, and we hope it works. But if you do experience some difficulties with it, we will add the link into the chat box, and you could view it there. So now it's my pleasure to introduce our three presenters from the OPHA Reproductive Health Workgroup. I'd like to introduce Caroline Shaw, who is a public health nurse in the Early Years Program at Halton Region Health Department. Jennifer Matos, who is also a public health nurse at the Durham Region Health Department. And also Mary Ann Gatbonton, who is a public health nurse at Toronto Public Health. So Caroline, I will now turn over to you. Thank you.
All right, thank you, Daniel. So good afternoon, and thank you for joining us. As part of OPHA's Reproductive Health Work Group, we'd like to share our recently released position paper, as Daniel said. So it's entitled Shift, Enhancing the Health of Ontarians, a Call to Action for Preconception Health Promotion and Care. And again, as Daniel said, it's myself, Caroline Shaw, Jen Matos, and Mary Ann Gatbonton. Oops, sorry, trying to. Thank you. So for today's webinar, our objectives are to define preconception health and how it impacts the future health of Ontarians, how to share, we're going to share highlights from our position paper, including current strategies and gaps and challenges, as well as recommendations. And finally, we hope to explore next steps related to the position paper, as well as next steps for preconception health in Ontario. So we hope everyone will consider how your role is impacted by preconception health promotion and care. So to begin, I'd like to introduce our work group, which was established in 2009. It's a very diverse group with 40 members from a variety of professional and lay backgrounds. We have public health nurses, registered nurses, midwives, childbirth educators, and doulas, representing mainly public health units, but also hospitals, education, health promotion, and community clinics. Currently, we have 18 of the 36 Ontario public health units represented. Members come from communities across the province, from Thunder Bay to Kingston to Windsor. Members are in a range of positions from frontline service delivery, program planners, and evaluators, as well as managers. There's a lot of reproductive health expertise within our work group. A membership survey found that 65% of our members had over 10 years experience in the area of reproductive health. This experience gives us a tremendous collective experiential expertise working along the reproductive health continuum. This continuum includes preconception health, prenatal health, labor and birth, healthy birth outcomes, postpartum health, and the transition to parenthood. The goal of the Reproductive Health Work Group is to advocate for accessible and equitable reproductive health services and supports across Ontario to better meet the physical, emotional, and psychosocial needs of all individuals in their reproductive years, regardless of gender identity, gender expression, or sexual orientation. As part of our work towards enhancing reproductive health services in Ontario, we felt there was a critical need to look specifically at preconception health based on the current lack of attention to this issue in Ontario and elsewhere in Canada. After about 2 years in the making, the Preconception Health position paper, at over 50 pages in length, was released in February of this year. It was a long process, but the benefits of having authors representing 8 different public health units of Ontario, as well as using expert reviewers for feedback and consultation, provides a depth to this paper that reflects the expertise in this field. Some of the reviewers included people from Ontario College of Family Physicians, Born Ontario, the Provincial Council for Maternal and Child Health, and more that you'll find listed on page 3 of the position paper. And now to introduce our position paper, Shift, Enhancing the Health of Ontarians, a call to action for preconception health promotion and care. All right, so now we're going to try to show the video. Okay, well, hopefully other people heard some sound. I didn't have any sound for mine, but if you go, again, to watch it some other time, there was nice music usually, and hopefully for you guys. Okay. So now we'd like to walk through the position paper and some of the key information captured in this extensive document. The aim of the document is to advocate for a coordinated and comprehensive approach to preconception health in Ontario. If the 50-page document appears too daunting, no worries, there's a 2-page executive summary also available. First, we'd like to share our definition of preconception health. Preconception health refers to the health of all individuals during their reproductive years. The reproductive years are the years when an individual is able to reproduce. For women, this spans generally from puberty to menopause, and for males, from puberty until possibly their death. We also wanted to highlight in our definition, regardless of gender identity, gender expression, or sexual orientation. While all individuals is usually stated in definitions of preconception health, we need to remember to go further than focusing on heterosexual women's needs, which is typically the primary target, and remember to include men and the LGBTQ populations. Preconception health is an approach that promotes healthy fertility and focuses on actions to reduce risks, promote healthy lifestyles, and increase readiness for pregnancy, whether or not having a child someday is planned. Unfortunately, only about 50% of pregnancies are planned, which articulates the need to encourage all individuals of reproductive age to look after their reproductive health in the event that a pregnancy were to occur. Often preconception health initiatives target those who are planning a pregnancy. However, since 50% of pregnancies are not planned, preconception health must include both planners and non-planners. Non-planners are people not planning a pregnancy, but are not preventing it either, or people who may wish to have children someday. Plus, we need to include those not wishing to have children someday. Positive reproductive health affects lifelong health regardless of if you have children. We want individuals making the right health decisions for their reproductive life plans, being intentional with their reproductive health choices, whether preventing a pregnancy or improving readiness for a pregnancy someday. Preconception health should include more than just health before a first pregnancy, but also the interval between pregnancies, called interconception. Pregnancy spacing, as well as exploring experiences from a previous pregnancy, can identify areas for intervention prior to a subsequent pregnancy. And finally, for our definition, when we talk about preconception health, we need to look at action on multiple levels: individual, community, and population. A health equity lens is important, and social determinants of health should be considered as preconception health initiatives and responses are planned. So why does preconception health matter? Despite universal access to high-quality prenatal care and advances in medicine, poor birth outcomes persist in Canada and Ontario. We know that preconception health can improve maternal and child health outcomes in the short and long term, which is the foundation for healthy children and families. In fact, Ontario has the second highest rate of preterm births in Canada at 8.1% after Alberta's 8.6%. And nationally, our preterm birth rate continues to increase 7.9% for 2010 to 2011. A recent World Health Organization report from 2014, cited at the bottom of this slide, highlighted that Canada's maternal mortality rate rose from 6 to 11% per 100,000 births between 1990 to 2013. More analysis is needed to determine the reason for this rate increase. However, experts suggest that rising chronic health issues, such as diabetes and obesity, as well as delayed childbearing, could be contributors. These emerging trends are discussed in the paper as there are concerns related to them. In Ontario, 39% of women were obese or overweight in 2012, and the rate of women giving birth at over 35 years old has increased from 15% in 1998 to 18% in 2007. More than just considering health benefits for many, there are also economic benefits to preconception health intervention and public health investment. For example, folic acid supplementation and diabetes care before pregnancy have both been shown to be cost-effective and save healthcare dollars in terms of shorter hospital stays for postpartum women and newborns. Research suggests that shifting our focus to the preconception and the interconception period is needed to improve health outcomes. Mother Risk states that although favorable pregnancy outcomes cannot be guaranteed, when a pregnancy is planned, many risk factors can be reduced and modified to enhance pregnancy outcomes. Unfortunately, for many of these modifiable risk factors, it takes time or many attempts to eliminate the risk factor. For example, tobacco use, which can affect one's ability to conceive, as well as cause negative birth outcomes such as low birth weight babies. Tobacco cessation is often a process that takes many quit attempts before success. For many risk factors, individuals need counseling and support prior to trying to conceive to understand the impacts of their risk factors on fertility and a future baby. Allowing time to improve one's health before conception is imperative. The critical period for fetal development is within the first trimester, the first few weeks, when many may not be aware of the pregnancy or have not had the opportunity to address the risk factors. And when considering males, the sperm needed for conception is maturing the few months before, so those months are critical for healthy sperm and fertility. In the appendix of this paper, there's a comprehensive table that discusses many risk factors for individuals during the preconception period and the recommendations related to fertility and effects on pregnancy and birth outcomes. Some examples of risk factors included in the table are healthy weights, substance use, emotional health, medical conditions, environmental toxins, sexually transmitted infections, and immunizations. Many lifestyle choices are reproductive health risk factors and are important health and wellness issues. By intervening before conception, there's an opportunity to educate, screen, modify, and manage health conditions and risk factors to promote optimal maternal and child health outcomes. Integrating preconception health into every contact with individuals within their reproductive years by healthcare providers can be as simple as asking one question. Would you like to have a child in the next 1 to 2 years? Depending on the response, it begins the discussion of preventing a pregnancy or considering risk factors to modify related to fertility and adverse birth outcomes. Preconception health does not need to be the standalone purpose of a healthcare visit, but an issue that can be integrated into a discussion with a healthcare provider at every visit with an individual of reproductive age. So how do we move forward to address preconception health in Ontario? We need to change how we conceptualize and deliver reproductive health services in the province and ensure that we are more coordinated and consistent in our approach to preconception health. Now I'd like to turn it over to Jen to discuss some of the strategies related to preconception health.
Hi, thanks. All right. So thanks, Caroline, for outlining the importance and value in shifting our attention to preconception health. And while the best way to deliver preconception health information is still unclear, we know that multiple strategies working synergistically is a proven approach. We need to look at preconception from the clinical and community levels to support the duality of preconception health. So looking at both the clinical care piece and the health promotion piece. And as Caroline mentioned, we need to broaden our target audience to move beyond heterosexual women alone. We need to involve individuals who are planning a pregnancy and also the non-planners. This is not an easy task. It is a broad target audience spanning decades of an individual's life, and that can be the challenging part. So our paper focused on 5 strategies for preconception health. These strategies came from the literature as well as what was being primarily used in practice in Ontario. We also looked at strategies from our neighbors, including the significant strides made in the United States. Certainly there are other strategies that we did not include that are still very promising approaches. And for each strategy, we will discuss in the paper, we did look at the strengths of the approach as well as the gaps of its use in current practice. So in no particular order, the first strategy that I'll be discussing is public awareness campaigns. And public awareness campaigns are certainly a very popular strategy. Various health communication campaigns have been developed in Ontario at the local and provincial level, such as the What's Your Plan campaign by Toronto Public Health and the Best Start campaign, Is There a Baby in Your Future? The current challenge is to determine the best way to communicate the breadth of preconception information and then motivate individuals to take action. So next we looked at the use of innovation and technology, and that can be used as a tool to improve and expand preconception health delivery. It has the potential to improve the quality, reach, accessibility of preconception health and may even result in positive behavior change. Technology may help to overcome barriers experienced in delivering preconception care, such as provider time and knowledge, as well as increasing accessibility to client populations who primarily access their health information online. Current initiatives include the GABI preconception system, which allows users to develop a personalized health record, and various mobile apps such as the M+B2B, among others. And looking at reproductive life plans. So a reproductive life plan is a tool to help individuals develop personal goals as to whether or not, when, and how to have children. Fundamentally, it promotes healthy lifestyles to planners and non-planners to affect lifelong health. The Youth Reproductive Life Plan, developed by Best Start in collaboration with several other health units, is available on the Best Start website and was recently approved for use in the Pathways to Success high school program. And we also just learned that Best Start will begin the process of developing an adult reproductive life plan, which is very exciting. And looking at integration of preconception health care, it is well documented that healthcare providers are the preferred and trusted source of information, which makes them a key stakeholder in the promotion of preconception health. Integrating preconception care into every contact between a healthcare provider and an individual of reproductive age is well supported in the research. The annual physical was once considered an opportune time to provide preconception care, but now the guidelines regarding annual PAPs have changed. So further research is needed on how to promote preconception health and how to support physicians. Moving on to healthcare provider outreach. In Ontario, a lack of training and time are frequently cited as barriers to physicians providing preconception care. It would be beneficial to have a standardized preconception care education program for healthcare providers in Ontario, as exists in the United States. And so while the best strategy is still unclear, there are many promising strategies, some we haven't even touched on today. We know that we need to shift the balance of attention from the prenatal period to preconception, but we still need more research to evaluate the effectiveness of various strategies currently being utilized and be mindful of some of the gaps and challenges. So the first one that we're going to look at is data monitoring. And the Centers for Disease Control and Prevention, the CDC in the United States, has a great example of a data monitoring system with over 40 indicators related to preconception health. And the Association of Public Health Epidemiologists in Ontario and Public Health Ontario recently reviewed indicators specific to Ontario and found that many gaps related to public health exist. And currently the only indicator is folic acid supplementation, but plans are underway to create more indicators in the near future. And next, research and evaluation. Limited research on general preconception health and effective interventions exists, particularly regarding those that are community-based and from a health promotion perspective. To date, most preconception health programming and research has taken a behavioral approach, focusing on changes at an individual level. So we know that there is a need to shift the focus from an individual's responsibility for preconception health to a broader socio-environmental approach, whereby the responsibility also lies at community and system levels. So we also need to explore the preconception health impact of various important social determinants of health, such as race, income, social connectedness, employment, and air quality. And looking at political and public awareness, political awareness specifically and support is needed to shift the reproductive health continuum to include preconception health. So while there has been growing awareness of preconception health in recent provincial reports, there is limited political support for it in Ontario. Many still see preconception health from the heterosexual woman's perspective and overlook the understanding about a man's health and contribution to the health of a pregnancy and baby. And in fact, the World Health Organization recommends that boys and men should be encouraged to become active partners in preconception care. And men are not the only group who require more focused attention. Initiatives to date have rarely been tailored to the LGBTQ communities. One example that we did find, though, was from the Ontario Midwives Association, and they've developed tip sheets in providing care to lesbian, bisexual, and queer women, and for all trans men and trans masculine spectrum clients. Developing strategies that specifically target diverse groups will help to shift and normalize the discussion of preconception health and overall reproductive health, which will foster informed decision-making and reproductive life planning among all individuals. And lastly, looking at resources. So preconception health is mandated in the Ontario Public Health Standards, and these standards are not specific, so local health units must prioritize preconception health programming and then allocate resources accordingly. So without strong advocates who can champion the importance of local public preconception health programming, staffing and resource allotments to preconception health may be lacking. So why now? Most simply that the timing is right for shifting our focus to preconception health. As we discussed earlier, a comprehensive approach to preconception health is lacking at both federal and provincial levels. And although preconception health promotion is mandated under our Ontario Public Health Standards, there is no standardized or recommended program for public health units to follow, leaving each unit responsible for prioritizing resources and developing resources based on their own local needs. So we know that the breadth and scope of family health programming in Ontario public health units is large, and as a result, preconception health initiatives must compete for limited resources. And in clinical settings, standards are fragmented, and guidance and supports to integrate preconception care into practice are often lacking, leading to inconsistent and incomplete care across jurisdictions and institutions. There are a few clinical tools for preconception health. Recently, the Ontario Ministry of Health and Long-Term Care engaged with the Centre for Effective Practice, and in partnership with the Ontario College of Family Physicians, they developed and disseminated a preconception care assessment tool. So it's very exciting to have a preconception care specific tool. However, we'd like to see it linked to the electronic medical records and have a system in place to compensate healthcare providers for incorporating preconception care into their visits. So we look forward to maybe what the future will hold for the new tool. And a comprehensive approach is one which will include all facets of health promotion. Awareness raising alone is not enough. We must move beyond this and include strategies to create supportive environments, skills development, realignment of health services, and policy development. So now I would like to turn it over to Marianne to discuss our call to action.
Hello, okay, thank you. Now that Caroline and Jennifer have provided an overview of the preconception health, the strategies and the gaps, and in an effort to address these gaps and challenges that were highlighted in the paper, we organized the call to action into 4 categories, which we like to call the 4 I's. So interdisciplinary collaboration, integration, innovation, and inquiry. I will review each of these categories and share our recommendations to shift these actions forward. So our first action, as you can see here, is interdisciplinary collaboration, which speaks to the need to connect beyond our own boundaries to foster a richness in dialogue and mutual understanding. Working in silos is not effective. collaboration across a range of sectors is needed to enhance and support the duality of preconception health, which is health promotion and health care. If we are not afforded the ability to talk openly about the realities and opportunities within each other's disciplines, we will continue to provide service in isolation, and care will remain fragmented as opposed to building on each other's strengths and expertise. When speaking of healthcare, it is not only physicians and public health staff that we are referring to. It's nurse practitioners, pharmacists, midwives, and OBs as well. Is there some way to achieve a fluidity of care for the public? Does preconception health encompass more than public health and primary care? I would argue yes. Consider the role of education, the private sector, researchers, and even epidemiologists. These are just to name a few. So in response to this need, our recommendations included establishing an intersectoral, interdisciplinary provincial coordinating committee. We also recommend looking beyond the health sector and engage a diversity of partners. Our second action item addresses the need for integration of preconception health into existing services, structures, reports, and future developments. So within public health, preconception health can be integrated into sexual health services by introducing the Reproductive Life Plan. Interconception principles can be integrated into the HBHC, which is the Healthy Babies, Healthy Children program, and the Canada Prenatal Nutrition Program, CPNP. These are only a few examples. What about within primary health care? Realignment of services which fully supports preconception health may be beneficial, but how? The Healthy Kids Panel report recommends inclusion of a standard pre-pregnancy health check and wellness visit for women planning a pregnancy and their partners. A good start, but this would only capture those who are planning. Remember, approximately 50% of pregnancies are not planned. Perhaps what is needed is promotion of wellness at every visit. But how can such integration be supported? Is a designated preconception health code needed? Perhaps offering incentives through bonus codes is worth consideration. Would providing preconception health care be more readily adopted if integrated into medical or healthcare education? Okay, so let's look within public education. Where does preconception health fit? Are there opportunities to integrate preconception health messages within the new health and physical education curriculum? And what about provincially? Would it be worthwhile to consider a provincial e-resource highlighting the services unique to each community within Ontario? For example, the Toronto Public Health Campaign, What's Your Plan? This could be expanded to include other Ontario communities, with each chapter being identified by its region or city, such as What's Your Plan Region of Waterloo or What's Your Plan Thunder Bay. This could be a provincial campaign highlighting the importance of having reproductive life plan, with each city promoting local resources. There's so many questions and so many opportunities that we can take. So in light of this, our recommendations encompass ensuring concepts and principles are integrated, support realignment of health services, and developing policies and tools to support integration. Here is a chart to illustrate a few examples of how preconception health messages can be integrated into our current systems. Remember, these are just a few. There are many opportunities to enhance our current systems, and we will take the time at the end to discuss your ideas. The third action point revolves around innovation. Can we learn from other innovative tools such as the Mom and Baby to Be app by Niagara or the Text for Baby app in the US? Perhaps partnering with nonprofit agencies such as Heart and Stroke Foundation, the Canadian Cancer Society, and others could lead to an innovative e-tool which could encompass chronic disease prevention and preconception health targeted messaging. E-tool development for primary healthcare providers may be beneficial as well. Imagine, if a healthcare provider inputs the date of birth of a client who is within reproductive age into their system, this would create an automatic prompt leading the healthcare provider to ask a simple question, such as, do you plan to have children in the next 1 to 2 years? The answer to this will help tailor to care to the client's needs and potentially ensure a higher level of wellness for those when planning a pregnancy, as well as those who find themselves with an unintended pregnancy. Let's take it to the next level now. This e-tool could then be linked to a data gathering system, which would assist with gathering information and in turn could then be utilized to develop strategies individualized to each community. Innovative strategies need not only be e-strategies or social media type strategies, it may also be a new way of thinking and doing, such as how could universal access to folic acid be made possible? Recommendations developed in an effort to address innovation include investment into e-strategies and moving beyond traditional modes of communication and service delivery. So we need to think outside of the box. Our final call to action, Our final call to action encompasses inquiry, which includes research, data gathering, monitoring and evaluation, as well as establishing comprehensive core indicators for preconception health. Expansion of current indicators to include a broader array of characteristics is recommended, as well as the inclusion of all individuals is needed. Completing a comprehensive review of what core indicators would be most beneficial may be worth considering, and then ensuring that a system is in place to gather and monitor the data. Recently, many health units have fielded requests of what other health units are currently doing in the area of preconception health. I believe at one point, 3 health units put out a similar request within the span of 6 months. So establishing a provincial repository where preconception health data, programming, and best practices is more accessible is very crucial. So what are our recommendations for inquiry? We would propose complete a comprehensive assessment of preconception health indicators, establish a repository, and lastly, submit a locally driven collaborative project, the LDCP, to support the need for research in this area. Although the position paper is fairly comprehensive, the paper does have its limitations as well. Further exploration of the role and opportunities within education is warranted. Although we advocate for a wider target audience, beyond heterosexual women, we neglected to consider the needs of those who are new to Canada, those who have special needs, and those who are experiencing at-risk situations. We do mention the need for a health equity focus, but more attention is needed to address this area. And lastly, further exploration of the benefits that a preconception health approach can have on lifelong wellness may be worthwhile. Of course, there may be other limitations to the paper, but these were a few which became apparent as we were bringing this project to a close. In terms of next steps for the paper, we continue to disseminate the paper and recommendations widely. We encourage you to share the paper with your colleagues and networks as appropriate. Just over a month ago, we held a panel discussion at the Ontario Public Health Convention, TOPIC, and at the end of May, we will be presenting at the Ontario Family Health Managers Network, which is a forum for all healthy family managers and directors of public health units in Ontario. We're also exploring options to host a symposium or roundtable to bring key stakeholders together to further advance preconception health in Ontario. And lastly, we're also exploring the possibility of writing an article based on our paper for journal publication. So this brings us to the end of our presentation. If you have any questions, comments, feedback, feel free to post them and we will answer them in order. So based on our presentation today, I am wondering if there are any thoughts on how we can shift reproductive health in Ontario to better include preconception health. So let's open it up for questions and discussion. Sorry, not sure what happened there.
Thank you, Marianne.
No problem.
So you want to go to the previous slide?
Yes.
Okay.
Well, this one's supposed to be questions and discussion. That's okay. We can leave it here.
Okay. Great. So if you do have questions or have a comment about the question, please feel free to enter them into the chat box. Also, since we can also unmute your line if you would like to share verbally, just click on the if you raise your hand by clicking on the raise your hand button, and then I could unmute you and you could maybe share your comments. So, so I did have one question that came in during during the registration, and maybe we just start off with that. So the question is, what would be the best way to promote this information into our daily practice? So I think maybe it's going along the lines of disseminating the position paper, and so you mentioned that we might be sharing it at an upcoming conference. So are there any other ways that you recommend maybe sharing about the position paper and the actions and initiatives that are called out in the paper? That's open to any of the our presenters.
I'll take the question. It's Marianne. Definitely. I mean, talking within health units and talking about preconception health and integrating it within all our messaging, be it chronic disease, any kind of health promotion, any campaigns that we are doing, collaborating across the health units, I think it would definitely be useful. And if you're interested in joining OPHA, to give us some more ideas, that would really be very helpful. Caroline or Jen, do you have anything to add on that?
It's Jen. I think those are great ideas too. I know that for the Preconception Health group that worked on the paper, most of us have disseminated messages to our immediate colleagues through presentations or just sharing the email, and then hopefully people would maybe have an opportunity to come out to one of the conferences that we might be at in the future, and we would be able to get the message out that way. But certainly if you have any other ideas for where we can add to our distribution list as needed.
Great. So Susan Blue has requested that we go back to slide 24. So Susan, I put it to slide 24. I hope this is the right slide. And yeah, if you do have a comment or question about it, please feel free to enter that into the chat box. There's another question regarding the intersectoral interdisciplinary provincial coordinating committee. Did you have any maybe comments on how that might look like? Maybe providing just more details.
Oh, sure. With the interdisciplinary collaboration, we're hoping, even with the symposium, we're potentially working with with Public Health Ontario or the Ministry of Health. We're hoping to have a table more provincially, so we're talking at a higher level, and then we sort of have the same language. We're all disseminating the same messages. With physicians and midwives and nurse practitioners, pharmacists, OBs, all sitting around that table discussing how we can better promote preconception care. Does that answer your question, or were you looking for more details on that? Sorry, was that an email question, Daniel?
Yep. Yep. That's
Okay.
yeah. I think that's great. You know, we the question was about just maybe provide more clarity on what that might look like. But,
oh, okay.
Yeah. Well, I don't see any other comments or questions coming in. Oh, actually, we have a question from Susan. So Susan asks, can you speak further about outreach to the non-health professional community to promote preconception health? So thank you, Susan, for the question. Any comments about the question?
Well, one thing that we did talk about was education. So reaching out to, secondary and post-secondary schools, the medical education, reaching out to them and sort of getting the messages in a lot earlier. That was one aspect. Jen or Caroline or Catriona, I think you're on the line. Can you add to that?
This is Caroline. I was thinking mostly to the education as well and trying to get some of these messages started earlier, earlier even maybe before they're hitting puberty, but also just starting those messages now so they're thinking about it well before hopefully having children.
Daniel, could you unmute Catriona?
Yeah, so Catriona, I think we did unmute your audio. So hopefully you can get Catriona on the line soon.
That's okay.
So we have a question from Pagin. Can you tell us a bit more about the preconception assessment tool?
Sure. If Catriona is able to talk, or I can speak to it.
Can you go ahead, Jen?
Okay, sure. I know it was a long list of people who were involved in the tool, but it's put out by the Center for Effective Practice, and we could possibly send out the link to the tool. You can actually download it, and it goes through, I'm not sure offhand how many assessment questions, but it will give a specific tool, a Canadian tool, if there's one associated with that risk factor question from the tool. And we just know that that's kind of where it stops, that they've put the tool out, and then they would be happy to have organizations or other places get the tool out and into the hands of healthcare providers. So we might be looking at that in the future as to how we can support the dissemination of that tool as well. Oh, and they put the link in the chat box. Thank you.
And the tool goes over, it has many questions and many checkboxes, and it does go through healthy lifestyle, sort of are they planning a pregnancy, are they not? It's very based on the reproductive life plan. So it's a great tool if you need questions and a great start for healthcare providers to go through.
Great. We have another question. For people who usually do just-in-time research, for example, look up information right before they're planning a pregnancy, how do we target that audience, especially given the impact that preconception health has on pregnancy outcomes?
So it's Jen. I can speak to that. Certainly, it's, I know we defined it in the paper as a conceptual challenge, how to really target this diverse target audience, and the ages that it spans over is decades. So we're hoping that integrating those messages into education and looking beyond the scope of a healthcare or a health visit specific for preconception. Looking beyond that, how we can get the messages out in everyday life. And I think one of the tools that we're really happy with is the Best Start resource, so the Youth Reproductive Life Plan, and then we'll be looking, hopefully some of the Preconception Health Task Group members would be able to help with the development of the Adult Reproductive Life Plan. So, I mean, ideally they would have 3 months or maybe even a year or more in planning for a pregnancy, but certainly targeting the non-planners should begin right from puberty.
That's right. Yeah, that's a great question. That is a hard target audience to reach. However, the good thing is that they are planning, even though it's a short time, they are still planning. So getting the messages out as early as possible would definitely be beneficial. And working with healthcare providers, I mean, hopefully sending the message out in not just when speaking about pregnancy or planning a pregnancy, but any kind of chronic disease promotion, anything like that, of encouraging the public to be going to their health provider and asking questions about general healthy lifestyles and regular checkups as much as possible, and giving them that plan of, if every healthcare provider starts asking that question, are you planning within the next 1 to 2 years of having children? Hopefully that will trigger them to say, yeah, maybe I am, and starting that conversation from there. So I hope that answers your question.
Great. So we have I think it's a comment from DP. How difficult, easy is it? So it looks like a question. So how difficult, easy is it to expect healthcare providers, especially primary care providers who are stressed for time? Anyways, how easy is the uptake of these strategies by them? So it looks like more like a comment. So great. Thank you for your question and the response. So I don't see any other questions or comments coming in. So maybe we will bring the webinar to a close. Thank you everyone for joining us today, and especially thank you to our presenters from the OPHA Reproductive Health Workgroup for leading our discussion. You could definitely find more information and the position paper on the OPHA website. And a friendly reminder that the webinar has been recorded, and we'll be making that and also a PDF of the PowerPoint slides available on the OPHA website shortly. So again, thank you everyone, and we hope to see you at the OPHA's next webinar. Thank you.